Myself, Dr. S.P.Hemanand, MBBS MD Internal Medicine. I am consultant physician and practicing diabetologist. Today I am going to give in detail about the pre-diabetes and how to prevent, how to manage and how to overcome the pre-diabetes mellitus. And what is pre-diabetes mellitus? So the pre-diabetes mellitus is something your blood sugars are abnormal, that is, it is not very high enough to say it is type 2 diabetes mellitus, but it is slightly above the normal range. So why we discuss about pre-diabetes? It is important at present in our society because pre-diabetes mellitus is very important. It is like similar like type 2 diabetes mellitus. Even at this initial stage of pre-diabetes mellitus, our end organs, what we say, our vital organs, eyes, cardiac, heart and kidney and even our blood vessels and overall our body, what complications we see in type 2 diabetes mellitus, that can be begun even in the stage of pre-diabetes mellitus. So the pre-diabetes is something it is most commonly seen in the school-going children even after the 15 years and even a young adult between the 20 to 30 35 years. So the pre-diabetes is very important and it is mainly we have to take care ourselves by prevention of pre-diabetes. We have to take care by we should have a healthy lifestyle, that is eating the appropriate proper food and healthy food, and very importantly we have to maintain our body weight as per the what we say is a BMI as per the height and the weight, and thirdly is very important, we have to be a physical active because it is our because today present world and sedentary lifestyle is very important cause for pre-diabetes mellitus. So we have to do a proper physical activity and increase the physical activity, that is the most important concern for the prevention of pre-diabetes mellitus. Now how we'll come to know whether we have pre-diabetes or not? Because in pre-diabetes mellitus, it is unlike what in diabetes what we see increased urination, what increased thirst. We used to drink a lot of water and we used to have some fatiguability. We have tiredness, unable to concentrate, and the second thing we have some numbness and burning sensation in our legs, and these are the common symptoms we see in diabetes mellitus. And somebody is having some wound or ulcer which is not healed for several days or several weeks, that is also one of the sign and indications that you may have diabetes. So all these signs and symptoms, it not necessarily will be present in pre-diabetes, because pre-diabetes, 90 to 95% of the pre-diabetic, those who have pre-diabetes, they absolutely they don't have any signs or symptoms, because definitely nobody knows who is having pre-diabetes unless until we check our blood sugar or we have some important all these whatever signs which I mentioned, because few patients they may present with these signs like what I mentioned earlier. So very importantly, in presence of signs and symptoms, pre-diabetes is definitely 90 to 95% of the people, they are totally unaware and we won't come to know that we have pre-diabetes or not. What is the cause for pre-diabetes? When we say why do the pre-diabetes comes to us, that is a very what are the causes for pre-diabetes mellitus? Because we cannot exactly define what is the cause for pre-diabetes mellitus, because these are the main factors for pre-diabetes is one is we have modifiable and non-modifiable. That is non-modifiable, maybe it is a genetic that our parents or maybe our siblings or brothers sisters that those have diabetes, so we may be the high risk what is the cause for pre-diabetes. But it's almost all whichever the maximum causes we cannot define why pre-diabetes occur. So that is very important, and we can say the risk factors, risk factors for pre-diabetes, that is one is the age, because almost diabetes occurs earlier. They say diabetes is disease of more than 40 years or 45 years, but now diabetes the age is changing, because even everywhere around the world, because diabetes is seen from the childhood, that is from pre-diabetes to diabetes or young onset diabetes. So age is one of the very important factor, and as I said, it is a genetic because it's a family history. Those who are having a family history, their father, mother or sibling is having diabetes, definitely they should screen for pre-diabetes at the beginning, early stage itself. And again very important, as I said, lifestyle, because those who have sedentary lifestyle, those who work office 24 hours and without any physical activity, and those who are having a body weight more than what we say the normal BMI is within 18 to 24. So the BMI more than 24, those who are overweight or obesity, definitely they should screen for pre-diabetes mellitus. And in particularly gestation diabetes mellitus, what we say, those who have diabetes in presence of pregnancy, on after later on pregnancy their sugar becomes normal, that we call it as a gestation diabetes mellitus. So those who develop gestation diabetes mellitus in their life, in women, so definitely they have chances for developing diabetes mellitus, and they must also screen for pre-diabetes mellitus. And again, in women there is a condition called PCOD, that is polycystic ovarian disease. So again, such patients also definitely they should screen for blood sugar, because they are very prone for pre-diabetes and the later part of development of diabetes mellitus. The pre-diabetes is sometimes it occurs alone, or it may be associated with some other medical conditions, because it's very important when somebody is having other medical conditions also, like what I said, blood pressure, because somebody is having high blood pressure, they are very likely to develop pre-diabetes or diabetes. So the blood pressure, those who have high blood pressure, definitely they are very important for them to check their blood sugar, because it's very important. Always the blood pressure high is always associated with the development of diabetes, because of particularly why the reason is because the insulins become resistant for their function. And next, our cholesterol levels. Cholesterol levels is very important, because we should have a high good cholesterol. That is good cholesterol, what we say is HDL, because usually we should have a good levels of HDL. That is at least it should be more than 50. So that means and low LDL, that is a bad cholesterol. So anything abnormal with these cholesterol levels, which also can lead to development of pre-diabetes or diabetes. The next what we see is our thyroid function, because again thyroid function is very vital for important for all the functions in our body, even for blood sugar functioning as well as the sugar metabolism. Also thyroid is very very important for this thing. And the other medical condition, as I said, and because of pregnancy, and also somebody is diagnosed polycystic ovarian disease, and the other those having some respiratory problem, that is what we call the sleep apnea syndrome. So such medical conditions which can also leads to diabetes mellitus. So very importantly, as I said, there is three things is very important. One is obesity, cholesterol level should be normal, blood pressure should be normal, and other associated medical condition. If somebody is having this, then definitely they should screen for pre-diabetes and diabetes mellitus. Now, actually, what are the complications we face when we have pre-diabetes or diabetes? So pre-diabetes stage, as I said, even in presence of diabetes, what complications we see in diabetes, that can also be seen in presence of pre-diabetes. That is what we kidney problems. That is, it can affect kidneys, it can affect the cardiac. They can have a heart attack and stroke, and they can lead to amputations in the limbs, actually extremities, lower extremities, because of long-standing diabetes, or because it can affect the disease of diabetes or pre-diabetes is something. It can affect all the blood vessels in our body. That is the small blood vessels to the large blood vessels. Even a small blood vessel, the first affected is our eyes actually. That is what we see the changes in diabetes in eyes is retinopathy. So everybody we have to check for retinopathy, because if presence of retinopathy is there, definitely all the complications has begun already in our life. So everybody should screen for eyes to check whether they have retinopathy or not. And as other complications on later it comes, and also again, as I said, pre-diabetes, we find these complications, all this can be prevented. How do you know that you have pre-diabetes or not? Only by doing your blood check. That is, you have to check, there are 3 tests you have to do. One is your fasting blood sugar, and you have to check your postprandial, that is after meal, that is one and a half hours to 2 hours of your blood sugar. And the third very important is HbA1c, that is your average blood sugar. So these 3 things has to be checked, because when you call it as pre-diabetes, because when your fasting blood sugar is anything between 100 to 125, between 100 to 125 milligram per deciliter, and postprandial, that is anything between 140 to 200 in the range, and HbA1c. Normal HbA1c should be less than 5.7, and anything between 5.7 to 6.4 range of HbA1c, we we call them as a pre-diabetes mellitus. So the very importantly, we say these within this range, below this range is normal, and anything above this range we call it as type 2 diabetes mellitus. So pre-diabetes, always remember fasting blood sugar is between 100 to 125, and postprandial is 140 to 200, and HbA1c of level of 5.7 to 6.4. If you are within this range of your blood sugar, then definitely you may have pre-diabetes, and you have to consult your physician immediately. How do we manage pre-diabetes is very important. After when we come to know that we have a pre-diabetes mellitus, and the management wise you have to be very careful and you have to be very strictly followed, because as I said, the very important treatment for pre-diabetes is the lifestyle changes. That is, we have to eat healthy food at appropriate time, appropriate food, and we have to pay on pre-diabetes. Again, they have to reduce their weight. At least if they have 10% of the body reduction weight, definitely it will be a huge impact on their blood sugar levels. So the ideal, maintaining the ideal body weight, and increase the physical activity, and again to avoid the sedentary lifestyle, every steps counts for your blood sugar. So keep increasing your steps and save from pre-diabetes mellitus. And also the treatment, again some risk, as I said earlier, so there are some risk factors and there are some associated pre-medical conditions. In such cases, we have to implement lifestyle changes as well as a simple drug therapy, like we add some metformin. All medications can be added for certain patients as per the blood sugar and associated medical condition. So the treatment mainly, as I said, lifestyle is very important, and it has a huge impact on your health as well as the society. Hope it is very useful for you as well as for your family members. And if you have any doubts or queries, you can contact us, our hospital center, that is VP Medical Center, which is located at Perundurai, Bhavani Road, Perundurai. And also you can email your queries to my mail ID, and also we have a page in social media, Facebook, and you can email any of your doubts to our mail ID, which is given below. And thank you for watching, and have a great day and have a healthy life.